Joining me virtually, Dr. Paul Thomas, Plum Health Direct Primary Care. We're going to do an update on everything coronavirus that's happening out there right now as we do. Dr. Paul, welcome back, sir. It's good to see you.
Hey, thanks so much for having me on the show. It's fantastic to be here.
Well, it's fantastic to have you. I think the first thing that we want to do is go ahead and look at what the current case situation is in Michigan. I think people have been in the holiday spirit, in the holiday mode. Maybe they haven't had a quick update on what's going on. So, what does this tell you? Sunday and Monday confirmed cases. 3,239. In general, it seems like we're trending down. We're going to get fewer reports this next week because of the holiday. What do you think about that, Doc? Is what is happening with uh, Gretchen Whitmer and the restrictions working?
Yeah, I think they're working to some effect. I think we've seen some of the case count come down. We've seen a nice gradual decrease in the number of reported cases. However, that might be an artifact as people are traveling to other states, maybe visit family in other states, or people aren't getting tested over the holiday break. And so there it may be both things. I'm hoping that the restrictions that are in place have been helpful in reducing the spread of coronavirus, reducing the number of new infected. However, it could be that it's artifact from people not getting tested as much or being too busy around the holidays to get tested.
Yeah, I could see that being a concern. I mean, if you take a look at the graphs, you can tell that tests have been down in this last week of December. And one thing I will say though, as a highlight, where Michigan is outside of the norm, our hospitalizations too are below the national average. If you're looking at it from a per 1 million person perspective.
Yeah, and that's a nice thing to see as well. That's the reassuring trend in the data that we're having a lower hospitalization rate. Um, but we did see a big spike after the Thanksgiving holiday. We had a lot of people gathering together and spreading the virus amongst themselves, and that could happen again here after the Christmas holiday and the New Year's holiday. So we have to be vigilant um, of the people we spend time with and our interactions so that we can decrease the spread of the virus.
Well, that was one of the things I noted while I was running around dropping off packages to Daily Detroit members is that those roads were really busy. I mean, maybe everybody was doing the same sorts of things that I was, but those roads were really busy. Were leading up to Christmas, and then you also had a lot of flyers. You had a lot of TSA screenings over the last few days.
Yeah, I think they said that there were 8 million travelers during the Christmas season. So 8 million Americans traveling to different places to visit with friends and family. Um, and then you also have malls are open with a lot of holiday shoppers. Now, places like um, Somerset, I heard, were limiting the number of people that can come into the store. But then you just have a lot of people lined up and congregating in the hallways of the mall. So, it's kind of a double-edged sword. So we'll see how it plays out because there were people going out shopping, buying things, interacting with friends and family, maybe dropping off cookies, giving somebody a hug when you deliver them. All those
Right,
little things
right.
can play into the spread of the virus.
Well, and as things reopen gradually, the Michigan Health Department has been very measured with how they're doing things, and to the frustration of some business owners. But it's important that just because a place is open doesn't mean necessarily it's the safest thing to go to. I know that I've gotten a few different questions around gyms specifically because a lot of people are very excited to get back and like working out, especially considering it's so cold outside.
Yeah, gyms are always going to be a difficult place. It's always a great place to spread bacteria and viruses and germs because you're handling equipment and lifting weights and touching elliptical machines. I just think of those elliptical machines where people are grabbing those and working out in that way. So, and then also you have a locker room where you're setting your things inside a locker and removing them. And so if you work out at a gym, there are just so many surfaces where a virus can stay. And then also if you think about the air, people are really breathing heavily inside a gym. They're exerting themselves, producing more secretions, and that can be a great place to spread the virus. it is nice to work out. I've been doing basically all my workouts at home and outside to avoid going to my gym, which I love going to, but I can't do it right now because I know it's just too good of a place to spread the virus. So you can go to the gym. It's still not a great idea because of the risks involved,
Mm, mm.
which are really hard to minimize. You can wear a mask, of course, but people are still going to be breathing heavily, and people are still going to be touching weights, and it's really hard to disinfect all of those surfaces.
For sure, for sure. Well, one issue it's like when there's a step forward, there seems to be a half step back, or two steps forward, one step back. And that one of those issues I want to cover is vaccine distribution. It is absolutely great that vaccines have started to arrive in Michigan. However, that distribution is still very small to get started. You've got, about nearly 300,000 vaccines distributed in Michigan so far. You can take a look. I'll put some links in the show notes. The michigan.gov/coronavirus has a whole dashboard showing which kinds of counties it's doing what they're doing more in, that kind of stuff. But your grand totals aren't very high. And then one other thing I noticed going into this is that the hospitals tend to have a lot of vaccine juice that they're able to get a hold of, but local health departments and others, they do not. And that is a problem for a number of areas. And Dr. Paul, it's also a challenge for you.
Yeah, yeah, that's a big challenge for us at our office. Equitable vaccine distribution is predictable. The inequality that we've seen in this vaccine distribution is predictable, and we've seen the most powerful health systems, the largest players in the region, easily get their hands on the most vaccine and vaccinate their own employees because it probably reduces paid time off, it reduces infection, it makes them look good, on all of those things. Knowing you have less vaccine going to the community via the health departments, and the health departments are really should be proactive, and they are reaching out to senior citizens, nursing homes, assisted care facilities, whereas the large health systems are just vaccinating their own employees, whether they're clinicians or not clinicians. And that's really frustrating to watch as a primary care physician who doesn't have access to the coronavirus vaccine at this time, simply because I'm an independent family medicine physician. And there are a lot of clinicians who feel the same way. In fact, I was talking with one of my physician colleagues today. He's affiliated, but his staff at his independent medical practice are not affiliated. So he can get vaccinated because he rounds at one of the hospitals, but his staff is unable to, even though they work at the same office, see the same patients. It just speaks to the level of disparity around vaccine access. And my worry here is that this is going to be a harbinger for future inequality around vaccine distribution in the community, in the broader community, where we see residents closer to health systems that have access to the vaccine um, vaccine earlier than those who are poor or living in urban areas that are less well served by large hospital systems. And remember, hospitals build hospital systems and large corporate health systems. They build hospitals in communities where there is the best payer mix, and those tend to be the wealthier suburbs,
Right.
which fuels further inequality in healthcare.
And that's an ongoing challenge. I mean, so how many hundreds of patients are you dealing with, Doc, with the Plum Health Direct Primary Care?
Yes, so our practice takes care of 900 patients in this community in Southeast Michigan. The vast majority of those are in Detroit.
And that's the thing, is that the groups that are connected tend to get the healthcare, and that tends to be the situation in America over and over again. I mean, it feels like this is a manifestation again of that inequality. And then also, I think it's important to have like a real plan. Like, there's guidance up on websites and things, but one of the things I've noticed on Twitter and other places is a variety of medical professionals at different systems going, "Hey, I work with coronavirus patients each and every day," and yet some manager down the line is getting a vaccine distribution when they're not even seeing patients. They might even be working from home.
Exactly. And I've seen that where I've seen some people on social media proudly boast that they've gotten the vaccine, and they're clerical workers or hospital administrators. And so it's like, yeah, that's great for you, I guess, but there are so many other physicians who are on the front lines who are often too busy to take time away from seeing patients to get the vaccine because there tend to be like one site in, let's say, one of these large hospital systems. And if you're busy seeing patients, you can't necessarily take time out of your day to drive over there and get vaccinated. So it leads to a whole host of problems for individual clinicians. And yeah, it seems to be a free for all. Last night, NPR, or yesterday afternoon, National Public Radio put out a great article how doctors in certain hospital systems are feeling so frustrated and they can't speak up publicly about it because they fear losing their job from the hospital system. But they're on the front line seeing patients, and then they see the maybe the pathologist or the telemedicine physician getting the vaccine, or the healthcare administrator getting the vaccine, and they're unable to get that vaccine themselves. Yeah,
Ye-
as hospitals roll out COVID-19 vaccines, healthcare workers describe chaos and anger. That's from December 28th. Thanks for pulling it up.
Oh, absolutely. And I'll make sure to put a link in the show notes to it because I read that same piece myself and I had a lot of concerns around it. And Doc, let's be honest with people here. It's going to be a while till say I mean, I'm in a much lower risk group because I try to keep myself away from folks. I try not to be near coronavirus patients, da, 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 da. It's going to be a while till the rest of us get the juice. And then I think the others, the vaccine. And then I keep calling it the juice. I don't know why. I feel like, why I call it the juice is because when it's out, I will drink it like a Capri Sun. I'll be
Oh,
like,
there you go.
give me that vaccine juice. I want it.
Yeah.
But I feel like those who need it should get it and get it with speed. But also, we have an amount of time until the public is going to be able to get a hold of this for themselves, right?
Yeah, and that's the way it should be. It should be that the highest risk people in our communities are vaccinated. I'm really advocating for the independent nursing home workers, assisted living facility workers, those folks that work at group homes taking care of mentally ill or disabled folks. They should get the vaccine first because they're amongst the highest risk group, and they're taking care of patients who are super high risk. 89% of the people who have died in Michigan are over the age of 60. So we really need to vaccinate the people who are taking care of those older folks in our state. And that looks like vaccinating primary care physicians, healthcare workers, assisted living facility nurses and technicians and medical assistants who populate those facilities. And so that's where our focus should be. And then slowly, more and more people in our community are going to get the vaccine. I think the state has set out a good guideline, but where the rubber meets the road, enacting those guidelines or carrying out those vaccinations, that's where things get difficult. And that's where you're seeing these breakdowns in vaccine equity.
Well, us on Daily Detroit, we're always trying to look for solutions. What do you think is a solution to this issue?
Well, I think there's just so many failures starting at the federal level. It would have been tremendous if we could have had a vaccine database where clinicians and nurses and medical assistants could go in and put in their NPI number or national provider identification number or some sort of credential, and then be put into a lottery system where they got the vaccine based on need and geography and all of that. And that should have been coordinated among health systems and health departments, and some kind of working collaboration between those two entities would have been nice to see. And pragmatically going forward is just ensuring that people feel like they're able to speak up and say, hey, we need to get vaccinated here. We're taking care of elderly folks in this assisted care facility. We need the vaccine too. Or, hey, I'm a nurse working at an independent healthcare facility, and just because I don't work at the large hospital system doesn't mean I'm any less at risk or my contributions are any less valuable. And so we need to empower individuals to speak up and be counted and get the vaccine. And then further, we need to continue to educate people about the safety and efficacy of these vaccines and help people in all communities have access. Predictably, we're going to have challenges in low-income communities and in Native American reservations and the places where coronavirus has hit the hardest and has the least protections. So we need to be super vigilant and super proactive. We need to learn from the mistakes that we've already made in the pandemic about treatment equality and inequality and correct those when it comes to the vaccine.
Right. And, to give
And
people some,
that's my fear. That's my big frustration. It feels like we're repeating the same mistakes over and over and over again.
yeah, it does seem like we are. It's because we haven't had a coordinated response from the top. There's lots of things that our federal, like federated system of states and all that does well and is advantageous. But here, when there's a pandemic and they don't care about state lines, or county lines, it's important that there's coordination with this kind of stuff. I wanted to give people some context because we talked about, nearly 300,000 vaccines distributed in the state of Michigan as of today. If you look at Wayne County, we're only looking at 11,450 doses among 8 sites. So, and that's considered high right now, to give you an idea of where things are at. And if you look at someplace like Oakland County, there's been 38,000. Oakland County is a more affluent place. It actually has less population than Wayne County, but they've gotten more than 38,000 vaccines distributed, whereas Wayne, just 11,450. It gives you an idea that there is definitely inequity in the system. You look at Macomb, 12,000, and they have 6 sites. So it's something where if you're more well off, you have more access to healthcare, but that's kind of the situation in America in general, right? I mean, this is a horse we've been on a lot of times. Some people don't like that we talk about it, but I mean, the fact is the fact. Whatever it is you think of the system, it's not equitable.
Yeah, and that's a huge challenge throughout this pandemic, and it's going to continue to be a challenge until we empower individuals and communities who have been left behind by other health inequalities and other issues, and we continue to kind of put this off and kick the can down the road. And it's kind of the question is always going to be, when are we going to stand up and address these inequalities? And I think now is the best time to do it, of course.
Well, for sure. Is there anything else you want to leave people with before I let you go?
No, thanks for having me on to talk about this, and everybody stay safe. I hope everybody can have a great New Year's Eve celebration, a great New Year in a safe way. And we'll keep washing our hands and masks, prevent any future spread. And hopefully we can truly turn the corner on this in 2021.
I hope so too. And sir, we will talk again, I'm sure.
Thanks, Jer. And thanks to the Detroit listener community. We appreciate you.